This video is intended for PTs and PTAs to show how you can use your skills in recognizing clusters of symptoms to significantly reduce a diagnostic delay, a huge delay in diagnosis that crosses multiple generations. And without the right diagnosis, people can't get the resources they need. But you can help. You can lead people from symptoms to diagnosis to good resources. We focus on myotonic dystrophy type 1 in adults, a progressive multi-system genetic disease. For more detail, please view the full 15-minute video. Here we go. Myotonic dystrophy is the most common form of muscular dystrophy in adults. Myotonic dystrophy type 1, called DM1, is considered a rare disease, but recent research has found much higher rates of DM1 than previously thought. People with undiagnosed DM1 may have symptoms that bring them to your PT setting. Once DM1 is suspected, it is not difficult to diagnose. It's caused by an expanded number of CTG repeats in the DMPK gene. A simple targeted blood test can confirm it. But as with other rare diseases, there's a delay in diagnosis. The average diagnostic delay has been reported as 7 years. Reasons for the delay include low awareness of DM1, variability of symptoms, and it's not included on typical genetic testing panels. But you can learn how to recognize DM1. And again, once it's suspected, it's not difficult to diagnose. PTs and PTAs can use their skills to help move patients from symptoms to diagnosis to good resources. How do we do this? Our training, skills, and experience have taught us to think of certain diseases and diagnoses when we see certain clusters of symptoms. When we see pill-rolling tremors and a festinating gait, we think of Parkinson's disease. For DM1, there are published care recommendations that include lists of symptoms that lead to a suspicion of DM1. Remember, once suspected, not hard to diagnose. Some symptoms we can recognize from our physical therapy training. Some show up in charts and some in conversation. As a progressive multi-system genetic disease, the effects of DM1 worsen over time. The care recommendations state that a diagnosis of DM1 should be suspected when either 3 of these 4 symptoms exist. We call them the big 4, or in a person with one of the big 4 or a family history and at least one of these 8 other symptoms. As PTs and PTAs, we can shake a patient's hand. If they can't release from the shake, that's myotonia. We can look at them as they're talking. Are there signs of facial muscle weakness? If one or both eyelids seem droopy, that could be eyelid ptosis. And we definitely know how to recognize distal muscle weakness. If somebody has these 3 symptoms, the care recommendations say to suspect DM1. These symptoms, as well as irritable bowel syndrome, excessive daytime sleepiness, and mild learning disability, are things that we can recognize from observation, testing, or conversation. And again, once suspected, not hard to diagnose. If that's all DM1 was, our biggest concerns would likely be fall risk and energy conservation. That definitely exists, but DM1 goes way beyond that. The disease does so much in the body and impacts so much in life. Genetically, there's a 50% risk of the next generation inheriting DM1, and the research shows it's no longer spontaneous. All current people with DM1 inherited it from the previous generation. Up the line, somebody else has it, even if they don't know it or show it. How can that happen? DM1 demonstrates something called anticipation. Anticipation can mean that each generation has more repeats, those blue squiggles, and the symptoms can start earlier. They can become more severe, more widespread, or often both. Down the generational line, that can mean lots of planning. Getting the right resources is really important. Looking back up the generations, it can mean that the silent risks for fatal heart blocks or responses to anesthesia exist, but they're not recognized and other symptoms may not be noticed. For all, potential consequences include death. People can die from DM1 without knowing they have it. Your single thought of, they might have DM1 can help change and save lives for your patient and for up and down their generations. When you have that thought, the full video discusses next steps. To review the diagnosis section of the care recommendations and for so much else, we use the Myotonic Dystrophy Foundation and their website at myotonic.org. Recognition is the key to getting help. As trained physical therapy practitioners, you have the ability to recognize clusters of symptoms. If symptoms of DM1 bring undiagnosed patients to your PT setting and you notice and recognize possible symptoms of DM1, remember the word myotonic to find your way back to this video and to the full video, which provides access to even more resources. You can be the one to help decrease that huge diagnostic delay and lead people from symptoms to diagnosis to good resources to change and save lives.